Hey everyone, welcome back to another episode. Today I have a real pleasure. I get to talk with a friend of mine who I've known her all the way back through undergrad, and we did a lot of classes together. And she was a year ahead of me in medical school, and her name is Dr. Libby Crockett. She is a OB in Grand Island. She works at the Grand Island Clinic as an OB. She has a master's in public health, and we are going to be talking about COVID and all things OB today. So I would love to just talk through like breastfeeding and COVID vaccine and pregnancy and infertility and all those things. But if you could start, Dr. Crockett, could you kind of illuminate for us what it's been like in the midst of a pandemic as an OB in smaller town, middle America in Grand Island?
Yeah. Well, I can start out with, so Grand Island ended up being really one of the first places, not just in Nebraska, but in the country where we really saw like a really big spike in COVID cases. And it was really before we had a lot of testing available. And a little background, I am an OBGYN, but I work in a multi-specialty clinic in Grand Island. So it's OBGYNs, there are five of us here, and then we have pediatricians. There were five pediatricians, and then five family medicine doctors too. So it wasn't just about what we were seeing from an OBGYN perspective, but like what our whole clinic was seeing. And that last week in March of last year, we didn't have a lot of testing available, and we all of a sudden had this huge spike in people calling in with like URI symptoms or shortness of breath. And we knew immediately that it had to be COVID, but we couldn't test for it. And so we were really scrambling to figure out how do we create systems? How do we keep our employees safe? How do we take care of patients? Who do we decide needs to go to the hospital? How do we keep people out of normal clinical situations so we don't spread COVID without really a lot of good like data at the time about how to do it. And then a little bit of other personal context at the time, I was 24 weeks pregnant.
Okay.
So I was also had that in my mind, like not only as an obstetrician, but as one of the quality, patient safety people in our clinic. And then also as, personal level, being pregnant myself, what were we going to encounter and what were we going to do about it? What was this going to look like? So it's
So
pretty
you're really
intense.
like on the frontier then of having to figure out in the midst of a crisis in the community where the numbers are going up, and we're at the exact same time seeing the devastation in places like New York, and a lot of the rest of the country has been relatively spared at that time. And you're having to figure out, how do we see patients, how do we keep our staff safe, how do we keep ourselves safe, and you're pregnant. So I mean, I'm sure that was just so stressful and scary to be in that situation where you just don't know what to do and what works and what doesn't work, and what's it going to be like in 6 weeks. Is it going to be as bad as New York or worse than New York or something like that? I'm sure that was just a really trying time.
Yeah, it was, you're trying to figure out how do you take care of people in a totally different fashion? Because normally when you take care of people, you bring them in, you see them, you examine them. And in this case, suddenly we were like, well, that might not be the safest thing for everybody else.
Right.
So how do you still give care? How do you evaluate people? Like how do you do this? It's like redoing your entire um, clinical strategy that we've has been ingrained in us since we started medical school, and like redoing all of those systems within a couple of days. And
Right.
we started seeing, because if you all remember that the CDC was saying sick people, if you're not symptomatic, people that are not ill should not wear masks. And that was still kind of
Right.
happening when this was going on. And so we actually had staff that were starting to get ill, and we knew we had it in the clinic, and we knew that we didn't know if it was, if they were getting it from community spread and spreading it to each other, if it was coming in from patients and getting our staff sick. And so even before the CDC said that masks, universal mask wearing should happen, we said we have to implement something, and that's the best tool we have to start with. So we did do that. Um, and we even closed our side down for like 4 days just to do cleaning. I mean, we stripped the exam rooms because there was a paper that came out of UNMC that looked like viral particles. We didn't know if they were infectious or not. Were sitting on surfaces in the rooms of the people that had come off that Princess cruise ship that were being housed in
Right, right.
Ashland. And so we stripped the rooms all bare. We cleaned them. We let them sit for 4 days without anybody in them. You know, we took our curtains down
Wow.
and we took the clothes out of the room. So, I mean, um, you know, anything we could do that we thought might reduce the risk of spreading an infection, we did it.
And it's amazing to think back at how far, like when I kind of you forget about these things, about what it was like at the beginning when we didn't know all those things. And now we kind of have a better idea of like that surfaces are probably not a huge
Yeah.
source of contamination, but back then you didn't know. And so, oh my gosh, like I remember taking, like stripping down and taking a shower immediately I got home and
Yeah.
like not wanting anybody to be near me or changing in the parking lot or those sorts of things. Um, and then to be in the midst of a surge at that time in your local community must have just been so scary and just confusing for everybody, and you're just trying to figure it out. And not only do you have your OB patients, but you have your family practice patients and the pediatric patients, and then just responding. And I'm sure your training in public health somehow came into play in the midst of this. Can you talk a little bit about that, and like did that help you prepare, on the ground for this surge? Did that influence your ability to care for your patients, your family, to protect yourself and your family, and for the community?
Yeah. Um, I was faculty in the College of Public Health and in the College of Medicine before I moved to Grand Island. And so, um, you know, Dean Dr. Ali Khan was my boss for a year, or one of my bosses for a year, and he literally wrote the book on pandemics. And so
Right.
I had a little bit of kind of in the back of my mind, sort of that training on pandemic preparedness. I understood the public health system in Nebraska, which is, it's one of those things that people don't know or understand how that system works or how it's supposed to work, how it was designed to work.
Right.
It's actually designed really well, but some of the pieces of it that should have been allowed to work or have not always been allowed to work in its normal capacity in the last year. But um, and also just understanding what a pandemic is and how, like contact tracing works and
Mm-hmm.
how those types of like isolation and quarantine and those concepts were not new to me. I think everybody else has been quite easily brought up to speed within the first couple of months of that. But those were things that I had in my training that
Sure.
other physicians hadn't really seen. Um, and the other piece of that with a public health experience is a lot of advocacy training and then just understanding epidemiology. R
Right.
naught was not a new concept to me when the public health department brought all of us together. And I remember it was March 10th of last year, the health department had a meeting at the hospital with physicians and presented the scariest lecture that I have ever seen in my life. That they had predictions for if no interventions were implemented, how many ventilators would be needed in just our 3 county area, how many deaths there would be, how many people would get
Wow.
sick, and and also for Nebraska in the United States. And I just pulled those up at the end of March, and actually, like, I didn't go back and look at the ventilator use data. I'm not totally sure how to figure that out in Nebraska because it's always reported as hospitalizations per day. It'd be a little hard to
Mm-hmm.
figure out, but the deaths numbers and hospitalization rates were pretty consistent. But instead of 2 months into the pandemic, it was a year at the year mark that we saw those numbers. So we did slow stuff down for sure.
Wow.
But
And that I mean, this has just been such a eye-opening conversation for me to kind of remember back when we were like, how I mean, I remember reading reports on how to use one ventilator for two patients, and
mm-hmm.
all these different things that it was like we don't know what it's going to be like, and so we need to prepare for the worst. And obviously things did slow down, and it took longer than anticipated. Thank goodness that was the case. But um, I'm sure that having that background in public health did help at least to kind of know the terminology and know what the expectations were and how that could play out. So that was, I'm sure that was like, wow, a huge resource for your community. That you had that training and expertise, because like you said, everyone else is kind of like on the ground, like what is R naught and what is quarantine versus isolation, all those different concepts that like are just foreign. Now it's like second nature to everybody on
Yeah,
the street, like
everybody
what's
knows it now. It's
quarantine,
not
oh
new to
no, I'm in
anybody.
isolation, right. Well, let's
Right.
talk a little bit about the OB world. And I wanted to kind of focus on, because I'm getting a lot of questions right now about the vaccine. And
Yeah.
amazingly, we have a vaccine a year into the pandemic. There's been millions of doses. There's a lot of questions about those in the OB world. So, particularly pregnant moms, um, postpartum breastfeeding moms, and those trying to get pregnant or struggling with fertility issues or infertility. So maybe can we just break those down and maybe just talk through
Yeah.
each one of those, starting with pregnant moms, perhaps.
Yeah.
What do we know about COVID vaccine in pregnancy, and what should moms that are pregnant think about and consider as they're trying to decide, when they get offered the vaccine, what to do?
Yeah. So, 3 months ago, first of all, there's this awesome toolkit online. I think I'll text you the link so that you can, if you post it, people can have
Absolutely.
access to it. Um, and it goes through kind of the pros and cons. And that came out in December. And one of the things was um, in the initial clinical trials, pregnant and breastfeeding women were not included in the phase 3 trials. But back data, all the data that we were seeing from the safety data all the way through did not have any sort of plausible concern for risk with pregnancy like we would see with other vaccines that are live attenuated, like varicella or MMR, that we
Right.
don't give in pregnancy. Um, and there were a few women that actually got pregnant while they were in the clinical trial, and there were no adverse outcomes associated with those pregnancies. Um, and when you balance the risk of being pregnant and getting COVID, it really shifted that balance of it's safer to get these, especially particularly mRNA vaccines is what I'm talking about initially.
Right.
And then since that time, the CDC has that V-Safe tracker, and there's been over 30,000 pregnant women that have gotten registered on that. And so we do have data now, and there's
Right.
no significant increased risk of adverse pregnancy outcomes associated with getting the mRNA COVID vaccine in pregnancy from that. And we're also seeing now studies coming out looking at women that were vaccinated that are now delivering their
Right.
babies. And cord blood and neonatal blood is looking like there's pretty good antibody response to that, which we know we use that currently with just standard of care medicine for the tetanus, diphtheria, pertussis vaccine for the pertussis or whooping cough specifically. We vaccinate all pregnant women after 27 weeks because we know that a particular type of antibody called IgG gets transferred from mom to baby across the placenta after 27 weeks. So if we vaccinate mom, she boosts her immune response to whooping cough. Even if she's had that vaccine before, seeing it again stimulates a new response. She makes those IgG antibodies against whooping cough and passes it to the baby to protect them after they're born until they can get vaccinated themselves. So we're seeing that happen with the mRNA vaccine. We suspected that would be the case, and now we have scientific data to show that that is true. We're also seeing,
It's amazing that I mean that nature works like that. First of all, that like
yeah,
mom gets a vaccine or goes through the infection, and then baby gets protected too. I mean, just that is biologically plausible, and that we have that data from previous, especially pertussis whooping cough vaccine, that we know that that's the case, and that it's recommended to protect baby, because baby obviously can't get the whooping cough vaccine until they're 2 months old, and so we know that helps protect baby from exposure in those first weeks when it can be really serious. And it's just so neat, and I've heard from so many moms that it's been such a relief to get the vaccine, knowing that not only are they protected, but their baby will be protected once they deliver, and that sort of thing, and have those antibodies hopefully on board, going out into this crazy world.
well, another perspective that I have, having had a baby, and then also, as a public health background, as an obstetrician, as somebody who has public health expertise in maternal child health, and then also as a human being that's gone through this experience as well, you know, good social support is critically important in those, especially early weeks, but all the way through, you know, having children. And, you know, I used to counsel patients about, you know, make sure you have people lined up to help you hold the baby so
Right.
you can rest and, you know, bring you food and clean your house. And then all of a sudden COVID happened. And I'm like, you can't let anybody in your house. You can't do
Right.
anything. You know, don't. Whereas the vaccination now is allowing that to happen much more safely. You're vaccinated and your mom's vaccinated, and like, or your siblings or whoever, they can all come and you can be together safely in that time postpartum. And that's critically important for good outcomes, you know, less risk of depression, you know, better breastfeeding outcomes. All of those things are really important. And so, you know, being vaccinated is not just about, you know, you yourself getting COVID, but like protecting those around you and the benefits that you can see if your, you know, your small little community is healthy. So that's a huge other big incentive to do that. And it also, we are seeing moms pass antibodies through breast milk as well. So
Just around the clock or around across the board, then it helps because like you said, that's another thing that I've heard from a lot is like I feel comfortable having grandparents come help or
mm-hmm.
siblings or those sorts because we've all been vaccinated, and so we know that we're
Mm-hmm.
not going to spread it from person to person or person, you know, grandma to baby or baby to grandma or something like that. It just gives you that peace of mind that we all took for granted for decades, you know,
Yeah.
prior to all of this, that like you can be around those people, you can see your loved ones can hold your baby, all those things that we just didn't even consider as something that would be off the table at any point. So that's a great
Yeah.
point. So it sounds like what you're saying is that in pregnancy, the recommendation is to get the COVID vaccine,
Mm-hmm.
because it protects mom, it protects baby, it allows
Mm-hmm.
for the social support and support that's much needed in that postpartum period as well.
Yes, exactly. And then, you know, access to being able to go do other things that are really important, like, you know, breastfeeding support group or other things that you may, you know, taking your baby out in public to go to a doctor's office, visit babies can't
Right,
wear masks, you know, things like
right.
that. I think doctor's offices are pretty safe, so I don't want to be alarmist in that, but just being able to, if you're vaccinated, it reduced that risk all the way around.
How about for breastfeeding moms then? Those that already had their baby, they haven't, you know, had the opportunity or didn't get the COVID vaccine during pregnancy. They are breastfeeding now. What is the recommendation for them? Is it safe to do that while breastfeeding? Are there any specific concerns or things to consider with when mom is breastfeeding?
No, not at all. So I was breastfeeding when I got my vaccine. I wish they were including pregnant women when they were doing the clinical trials because we were a clinical trial spot for Moderna here in Grand Island, and I would have marched my pregnant self in to get that
Right.
vaccine if they would have let me in. So as soon as I could get the mRNA vaccine, I did. And, you know, that was important to me. Knowing what I know about science, I suspected that I would make antibodies and pass my baby. And science is showing that now. I'm actually participating in a study looking at that. It hasn't been published yet, so I don't know the data from the one I particularly participated with. But other studies are showing that that gets passed through, and so that's exciting to be able to know that just me getting vaccinated and continuing to breastfeed my baby, that he's getting some protection from my vaccination experience.
That's amazing too, and it must give you such a relief then that like to know like your vaccine you got it however long ago, but it's still working for you in those two different ways, protecting you, protecting baby, and that you're able to through breastfeeding to deliver that protection, which is just such a neat concept, and life affirming and everything like that when you're in the midst of like all of the
Yeah.
uncertainty to just know that doing that is safe. So what I'm hearing you say is it's safe to get the vaccine in the period where you're breastfeeding or postpartum period,
You bet.
and without concern, and then just keep breastfeeding like normal. I had also been asked by moms, do we need to stop breastfeeding for a period of time? And I said, no,
No.
please. I can't think of pretty much any reasons to just
Mm-mm.
stop breastfeeding all of a sudden and restart it. And so certainly get the vaccine, keep breastfeeding as usual. Expect that once your body starts making those antibodies, that a sub portion of those will get passed to baby and be protective as you're in the midst of going about your daily life in the midst of a pandemic.
Yeah, with breastfeeding, I don't think that there's any plausible way that any of the vaccine particles could get into your breast milk. The
Right.
mRNA is small. Our mRNA is meant to degrade very rapidly. It doesn't travel very far in the body. Um, Even if for some reason it did get into breast milk, I can't even imagine how it would. It would not survive the gut. So
Right.
there's no, long-term concern or reason to, not feed initially. And also those initial spikes probably happen, the biggest spikes of those antibodies initially probably happen fairly quickly after a vaccination. So to maximize that exposure, continued breastfeeding is always most ideal.
Awesome. So what I've heard so far is if you're pregnant, it's fine and safe and recommended to get the COVID vaccine. And
Mm-hmm.
if you are breastfeeding, then get the COVID vaccine to protect yourself and protect baby through breast milk. How about for those that are in the midst of trying to conceive, those that are having fertility issues or struggling with infertility? I know that when the vaccine started to come out, there were these articles going around, as articles tend to do, that made it sound like it was unsafe or that there would be long-term fertility issues with getting the COVID vaccine. So what does the science say? What's the data showing about that? And what is the recommendation for those that are in the midst of fertility issues trying to get pregnant with regard to the vaccine?
So there was a proposed mechanism of
Okay.
why this might cause infertility, and it had to do with um, basically a small segment of genetic code, which leads to a small segment of proteins um, in the spike protein of the coronavirus, um, very short in the grand scheme of DNA code and protein code. It's very small. That was similar to another protein that's necessary for human placentation. And so the plausibility was if you get vaccinated against COVID-19 and your body builds these antibodies against the spike protein, which is what the vaccine is designed to do, because that's the spike protein is how it invades your cells.
Right.
Then your body might create an autoimmune reaction against placental proteins that could cause infertility. So, first of all, infertility is the inability to get pregnant. And so the plausibility for this wouldn't, if that really were a thing, it wouldn't cause inability to get pregnant, but what it would cause is recurrent pregnancy loss. My lights are going
Okay.
off. Sorry, I'm not moving enough. Um, um, and so we are not seeing increased rates of recurrent pregnancy loss in
Okay.
these women that are, or, stillbirth or anything that would be related to or downstream of that um, proposed mechanism. We're not seeing
Okay.
that at all. The other thing to keep in mind is that based off of that same proposed mechanism of action, we would also see that problem in people who had COVID.
Sure.
We're also not seeing that. So, that's been debunked. We have a
Okay.
year's worth of data of, risk of pregnancy outcomes in COVID, and that's not something we're seeing. And we have a good 3 months of, I think there's over 30,000 women in that Be Safe CDC tracker, and we're not seeing that either. And we certainly didn't see it in the clinical trial, women that had incidental pregnancy. So that is not a valid issue or concern. I mean, I realize when you're facing infertility, you're so
Right.
worried that anything could affect it. It's really hard to, you know, switch that mindset or, do anything that feels like it might be risky, but there's no scientific data to support that claim at all.
My understanding was to go back to what you had said as the proposed mechanism, that it was a really small region that was conserved between that protein involved in placentation when the placenta attaches and everything like that, and the spike protein. And it was essentially like saying Romeo and Juliet and the Bible are the same book or could get confused for each other because they both contain the word the. Like it was is a really small region. So the fact that there's overlap is just normal biology, and the fact that there's only 20 different amino acids, and so there's going to be some overlap and some conserved areas between those. But you wouldn't confuse Romeo and Juliet with the Bible just because they contain, the word the in throughout them. And so that made me feel comfortable with understanding that, okay, this is kind of taking something that is scientific and making it seem as if it means that it's going to cause fertility issues. But not only do we have the biologic implausibility of that theory, we also have a lot of data now from people that have had COVID and from people that have gotten the vaccine that's not the case.
I love that example. The one I read and I liked and I use with my patients is it would be like saying that, let's say there's a cat wearing a blue collar and a rhinoceros wearing a blue collar, and that your body would mistake those just because they were wearing a blue collar. Like, no,
Gotcha.
you're not
That's a good
going
one
to
too.
confuse a cat for a rhinoceros just because they're both wearing a blue collar. But I like the book one too. That's a good one. I'm going to steal that one and use that with my
Well, I'm going to
patients.
steal yours too because I think that's a good one too because I think it makes the body seem too simplified compared to what I mean. There's so much nuance that we can fight off measles and we can fight off influenza, but we don't fight off the peanut butter and jelly sandwich that we ate. Like those are all
Right.
very specific, different foreign invaders, but our body's able to discriminate much better than we are, and I like that example too. So
I'm
from what you've said, protecting against getting COVID for the person that's going through fertility favors getting the vaccine. Am I understanding that correctly?
Yeah. Yeah.
Okay.
You should get the vaccine.
Okay. So in the OB world, it would seem that those that are trying to get pregnant, those that are
Mhm.
currently pregnant, and those that are postpartum and breastfeeding, all safe, effective to get the vaccine.
Yep.
Are there any other things that we haven't talked about in the OB world that are related to COVID right now? I know we kind of focused in on the pregnancy and peripartum period. What other issues are you facing with coronavirus with the vaccine in your practice?
That's a good question. Visitor policies,
Mm,
um, abbreviated schedules for obstetrical care, those came
sure.
out, that sort of thing.
Those things that are kind of
Social
like
thing.
softly related, like they're related, but they're
Yeah,
really important, like
huge
having
impacts
visitors in the
on all of
hospital.
those things that make a big difference. Of course, we're seeing pregnant women get critically ill. We were fortunate enough to have as many as we thought we might have here. But we certainly took care of pregnant women that needed to be hospitalized with
Sure,
COVID. Um, and, it's any kind of respiratory stuff is really complicated in somebody who's pregnant and has
sure,
decreased ability to breathe normally just because you have this big thing in your belly. You
right.
can't breathe in the normal way you would. And so you're a much higher risk for any complication for any kind of viral illness that affects your lungs, whether it's COVID or influenza. Um,
Well, it sounds like it's imperative that people that are of this childbearing age consider getting the COVID vaccine to protect against that and to protect the community at large. And gosh, I'm so glad that you are out in the thick of it and that you have navigated these waters so well and helped other physicians along the way too, because having that background in public health is just so immensely helpful, I'm sure, for you and for your clinic and for our community. I think that this is something that has really challenged everybody, and I guess I would love to end with any like rays of hope or light that have come out because of this. Any silver linings that you've experienced through the pandemic? I know it's been hard. I know there's been so much uncertainty and all those things, but are there any silver linings that have been brought to light for you in the
yeah,
midst of this?
I think that we are going to see this mRNA technology, vaccine technology for a CMV vaccine. And cytomegalovirus or CMV causes birth defects.
Right.
And we don't currently screen for it because we don't have a vaccine for it like we do for rubella. or chickenpox, which also fall into that category. And so
Right.
I think we're going to see a huge breakthrough being able to vaccinate people for CMV. And it's not just obstetrical care that CMV really plays a role, but transplants and
Right.
cancer patients, and so and blood transfusion. So I think being able to vaccinate people against CMV is going to be a huge breakthrough that we haven't been able to do before. And those vaccines look like they may have some promise for some particular types of cancer treatment too. So that's really exciting. All of those have been in the works since around 2003,
Right.
when we first started seeing major global outbreaks of coronaviruses that could cause severe respiratory inflammatory disease. So they've been around. They've been studied for a really long time, probably maybe more than any other vaccine in history that's come to being used wide scale. So I mean, there is a lot of data behind them. There The other thing is the implementation of telemedicine.
Sure.
We've really struggled for a long time to be able to use technology in a way that we could reach patients. And practicing in a more rural area, it is hard to reach some people for
Sure.
certain care. And a lot of OB/GYN is difficult to do via telemed. But one area of medicine that we really struggle with access to care, but lends itself beautifully to telemedicine or televisits is, therapy,
Right.
or psychological counseling. And now I can, give my patients access to a database where they can sort by any, licensed mental health practitioner in the state of Nebraska is available to them now. Whereas before, they might have to drive for an hour visit and show up 30 minutes beforehand because they don't know where in the office they have to go. And then, drive back another hour. And, it's 3 or 4 hours out of a day to go to an appointment like that. And now you can just, turn your computer on and have the same care and counseling experience. And that's really been huge.
That's
I'm
for
finding
us
a lot more.
too. Being able to do telemedicine has been a huge silver lining in this, and just having it be like, oh, we can provide good care via telemedicine. Well, we kind of knew that already, but insurance companies didn't know that, or wouldn't allow that. And now all of a sudden, it's like, well, that helps keep people out of the hospital. It provides the therapy that they need. There's so many different avenues for reaching people and connecting with people that otherwise you couldn't do before, or you had to get them to come in. And it's really easy to skip an appointment when it's far away and you have to drive, or you're not motivated to
Mhm.
go anyways. But it's hard when it's so much easier to do the appointment when it's in the comfort of your own home, on your phone, on your device that you're familiar with.
Yeah, I mean, we learned this in medical school. The most important part of a patient encounter is, obtaining a history from a patient
Right.
and, putting that in that context. The physical exam is important, but not as important as the history part. And so most of what we can do actually comes from that. So
I love it.
it's
Well, those are,
been awesome.
and I had thought about the mRNA technology before, but hadn't come back to that recently. But I love that point about, you know, there's no other chance you have to make sure that it's safe and effective and learn from it than in a pandemic, when you're giving the medicine to millions and millions and millions of people, so you can see those things that come out of, if it's safe, it's effective, what we can learn from that, and how we can apply that to future vaccines and be assured of the safety of that. So I think that is something else that we'll see more and more of in CMV. I know RSV was another one that they've talked about too, and
Mhm.
studying that for prevention of that respiratory disease in young infants as well. So
Yeah.
I am, those are some big silver linings that we'll be able to take away from all of the uncertainty and all of the everything terrible that's happened in the past year, that there's some things moving forward that will say, well, this came out of it and this has been for the better.
There's tons of collaboration and creativity that came out of this experience. And I think, as people get vaccinated, hopefully, as we're able to keep our numbers down and kind of move on to the next chapter, I think we'll start to see an emergence of the products of that. You
Sure.
know, new ways of thinking about how you do research, new research partners that maybe you wouldn't have reached out to before, but now that connection has been made. Labs flipped on their, research labs flipped and did totally new things in a very short time. And so learning their agility and what the capacity for their agility was and how they can maybe reuse that in new ways, I think is just really going to be impactful. I don't think we've ever practiced medicine in a way that really valued innovation the way it was desperately needed last spring. And so having seen that we can do that and make huge changes very quickly, I think really bodes well for being able to kind of work to create better systems of medicine.
I think I love the word agility. That is what we certainly all learned that we are capable of. And it's just, innovation has been huge in the past year. So there's been a lot of bad stuff, but there have been some bright lights, and that is certainly one of them. Well, it's been such a pleasure to talk with you. Thank you so much. This has been great, and I think it's been so helpful to just talk through the different pregnancy, breastfeeding, trying to conceive, and the recommendations, which across the board were that the vaccine is safe, effective, and recommended. So thank you so much. Please keep up the good work. Keep doing what you're doing. And we'll have you back on in another few years to talk about all the new OB stuff that's not pandemic related. It would be nice to talk about some non-pandemic stuff eventually.
Sounds great. I look forward to it.
Thank you, Dr. Crockett. Thanks for watching. If you like this video, will you hit the thumbs up button and subscribe so you don't miss any future videos that I put out? And if you'd like to learn more or watch another video, you can click right over here to keep going. Have a good day. Keep up the good work.